My name is Carlie Nicol, and I'm graduating the Mount Royal Yoga Therapy Program in June 2013. I am working at a clinic in Black Diamond called Salus Wellness, and I was chatting with the owner at the time. And Dr. Boulet, who is a developmental optometrist, who is next door to the clinic I work at, came in, and my boss introduced me to Charles. And he shook my hand immediately and was really excited to meet me, and I didn't understand why. And then later found out after a 2-hour conversation with him that he is integrating yoga therapy in the work that he's doing with the children, and things have just exploded from there.
So, for example, if a child is having difficulty tracking across a page, there's a variety of things that we can do, but again, we need to address the low-level balance and motor concerns. And then we can also, once we feel that the child is on track in terms of gross motor concerns, we can use simple techniques such as this, where they will simply track a ball or some kind of an object. We work on stability of the body and also look at the fine motor control of the eyes as one example. As another example of a technique that we can use that integrates well with yoga therapy is the application of prism goggles such as this. And prism goggles will shift not only the image, but they give us a spatial awareness shift as well as offsetting our vestibular or balance sense. And so in yoga, we would do a particular pose. By applying prism goggles, we add an additional load to the task, which makes it a little more challenging, and it allows us to accelerate the outcomes.
When we are working together, we do it over, let's say, the course of an afternoon. We'll spend a couple of hours, and I will show him the different things that I'm doing with the children, and he does those movements or breath work or meditations, and then provides me feedback on what he thinks he can integrate more vision therapy into it, how we can tweak things so it maximizes our time together. And from there, I take that information and then I go and create the next set of goals for that client that I can take to them. After 1 or 2 sessions with these kids, I've had parents contact me and say what their child likes, what they don't like, the differences that they're noticing in their child, whether it is more focus, more attention, and the ability to do the tasks that we're giving them, which is exciting for those parents to see that there is a light at the end of the tunnel for them.